Hi there everyone. Thanks a bunch for dropping by today to check out our latest video from Diabetes Health titled 8 Early Warning Signs of Diabetes You Should Not Ignore. But before we go ahead, make sure that you are subscribed to our channel, Diabetes Health, to ensure you're always the first to get access to all of our latest videos on managing diabetes better and improving your quality of life as a diabetic. So go ahead and hit the subscribe button now and give the video a like to help others just like you learn from this as well. What is diabetes? Now before we go on, let's look at what exactly is diabetes and why it's the leading disease affecting most people on the planet today. In fact, did you know that as of 2022, diabetes affects more than 37 million Americans, and that 1 in 10 people have diabetes? That's some pretty scary numbers, isn't it? Diabetes is a chronic condition in which the body either does not produce enough insulin or is unable to use the insulin it produces effectively, resulting in high blood sugar levels. Diabetes can lead to serious health problems if not managed properly, including heart disease, stroke, kidney failure, and amputations. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disorder in which the body does not produce enough insulin, while type 2 diabetes is a metabolic disorder in which the body is unable to use the insulin it produces effectively. Early warning signs of diabetes. Now let's take a look at 8 of the easiest early warning signs of diabetes to look out for. Knowing the early warning signs of diabetes can help you take action and make lifestyle changes if needed. While there are many potential signs of diabetes, we at Diabetes Health have compiled the most common 8 early warning signs. 1. Excessive thirst. Another common early warning sign of diabetes is excessive thirst. If you are feeling unusually thirsty all the time, it could be a sign of diabetes. This is because when your body does not produce enough insulin, it can lead to higher levels of sugar in your blood, which causes your body to increase its thirst in an effort to flush out the excess sugar. 2. Sudden weight loss. Unexplained sudden weight loss is another common early warning sign of diabetes. It is more common in type 1 diabetes. This can occur when the body is not able to use the insulin it produces effectively, which leads to an inability to use glucose for energy. As a result, the body will start to burn its own fat for energy, resulting in sudden weight loss. 3. Frequent urination. Frequent urination is another common early warning sign of diabetes. This is because when your body does not produce enough insulin, it can lead to higher levels of sugar in your blood, which causes your body to produce more urine in an effort to flush out the excess sugar. In children, this sometimes leads to nighttime bedwetting and accidents after potty training. Adults might not notice the increased frequency unless it means waking up more often to use the bathroom. 4. Blurry vision. Blurry vision is another common early warning sign of diabetes. This can occur when the body does not produce enough insulin, which can lead to a buildup of sugar in the blood. This can cause the lens of the eye to swell, resulting in blurry vision. 5. Slow healing wounds. If you are experiencing slow healing wounds or cuts, it could be a sign of diabetes. This is because when your body does not produce enough insulin, it can lead to higher levels of sugar in your blood, which can interfere with the body's ability to heal wounds. Possible causes of slow healing in diabetes include poor blood circulation, decreased immune system activity, inflammation. Slow healing cuts and wounds can be especially troublesome if they affect the feet. If foot wounds aren't promptly treated, it can lead to more severe complications, including amputation. The presence of glucose in the urinary tract and genital area may lead to infections, such as urinary tract infections, UTIs, or yeast infections. Researchers also suspect that poor circulation and a weak immune response may also play a role in the increased risk of infections. These problems are common in people with diabetes, especially if it's not well-controlled one. These infections are more common in those with female genitalia, but can occur in anyone. Sticks. Tingling sensation in hands and feet. A tingling sensation in your hands and feet is another common early warning sign of diabetes. This occurs when the body does not produce enough insulin, which can lead to a buildup of sugar in the blood. This can cause nerve damage, resulting in a tingling sensation in your hands and feet. In some cases, diabetic nerve damage can cause problems with internal organs, including your bladder and heart. 7. Fatigue. If you are experiencing unexplained fatigue, it could be a sign of diabetes. This is because when your body does not produce enough insulin, it can lead to higher levels of sugar in your blood. This can interfere with the body's ability to utilize energy, resulting in fatigue. Possible reasons include changes in blood glucose levels, poor sleep quality, poor nutrition, lack of physical activity, other diabetes symptoms, carrying excess weight, generally feeling unwell. Anytime fatigue interferes with your daily life, you should talk to your healthcare provider about it. 8. Mood swings. Similar to estrogen, testosterone, and the hunger hormones leptin and ghrelin, insulin is a hormone. When your body stops producing or utilizing insulin properly, fluctuating hormone levels can cause mood swings, irritability, and depression. Eating healthier foods, reducing your blood sugar levels, and receiving diabetes treatment can all help to regulate and treat your mood swings. Taking the early warning signs seriously. Now, if you do notice any of these signs in yourself or a loved one, be sure to schedule an appointment with a doctor and take a blood sugar test to identify your risk of being a diabetic. However, there's no need to panic. Making lifestyle and dietary changes is your biggest weapon against diabetes, and it can be managed successfully. In fact, one of the leading methods to manage blood sugar levels and diabetes is adopting a keto diet over the longer term. How the keto diet affects type 2 diabetes. The keto diet can have a major impact on type 2 diabetes, as it can help improve insulin sensitivity, reduce blood sugar levels, and promote weight loss. However, it is important to be aware of the potential risks of the keto diet, such as nutrient deficiencies, dehydration, and gastrointestinal distress. If you have type 2 diabetes, it is important to talk to your doctor before starting the keto diet. The keto diet has become increasingly popular in recent years due to its effectiveness in helping people lose weight, reduce their risk of chronic diseases, and improve their overall health. However, it is important to be aware of the early warning signs of diabetes so that you can take action if needed. Keep in mind that switching to a ketogenic diet isn't easy for people with diabetes or pre-diabetes. For help creating a plan that works for you, check out ketodiabetics.com, the web's most trusted source for custom ketogenic meal plans for diabetics. Subscribe to our Diabetes Health channel and do visit our website, ketodiabetics.com, to learn more about the keto diet and diabetes management. Till we meet again soon, ciao.